Hi, my name is Jefferson Macias, and I'm here representing Singularity Healthcare. Did you know that 38% of the time that practitioners spend with their patients is not actually spent on their patients, it's spent on their paperwork? That 35% of all operating costs can be attributed directly to communication activities lost and going forward between practitioners and their patients. Did you know that health records are inaccurate 30% of the time? The quality and the quantity of medical information has become unmanageable, and patients are frustrated and doctors are frustrated. This is where Singularity Healthcare Systems can help. Singularity Healthcare Systems. We are a medical software design company that specializes in medium to small size practitioners and their patients. My name is Jefferson Macias, and I am the CEO of Singularity Corporation. Keon Garraway is our CFO. Keon has extensive startup experience in the mining industry and has done this for the last 3 years. Rolf Lawrenson is our Chief Operating Officer. He comes from Starbucks in Holland, America. He has startup and new business experience in his days with T-Mobile, Starbucks, and now with Holland, America. Taylor Link. She is our Chief Development Officer and Chief Marketing Officer. She works for the state of Washington and also has an undergraduate in marketing from Arizona State University. She also has extensive experience in the healthcare industry. So what is an electronic health record? Well, an electronic health record is a systematic software that enables less paperwork for doctors, better decisions, lower costs, and better care. This is because you take all of the paperwork that doctors have and you combine it electronically. So the past history is there, the current information is there, and it's all at the fingertips right there for the doctors so they can know exactly what they need to do and they don't have to waste their time fumbling through charts, through paperwork, etc. So why is our electronic health record better? Well, size doesn't matter in this case. Unlike some of the large companies like Microsoft, GE, and Allscripts, we don't market to large conglomerate hospitals and large practitioners. We actually market to the small and medium-sized markets. The reason we do this is because we see a market that really isn't being serviced right now. Because many of the large companies, the big dollars aren't there. They want large money for the large investment that these companies are putting in for it, and they want the large profit returns. Well, we see a synergy of many small and medium-sized companies that want and need these systems that aren't being serviced. And that's where we propose that we're going to take advantage. So, EHR users across the board, whether you're at a large company, a large hospital, or you're at a small practitioner, they want enhanced usability. They want accuracy. They want cost savings. Patients, they want to be able to go in and collaborate with their doctors, meaning having a good discussion with your doctor. So about your health care, this is where the future is going. Patients want to play that role. And the EHR industry is going to become a large global opportunity. We're more focused on the United States right now, but we feel that we can in time take this global. So what makes us unique? What is different about Singularity Healthcare Systems? Well, like I had mentioned before, we target the small to medium-sized companies, but we also target the practitioners and their patients. We provide software that helps the patients interact directly with their doctors so that you can save time. This saves time not only on the patient's end, but the doctor's end as well, because you're reducing the interaction you need and you're reducing the costs. So the 3 principles of our solutions. We provide empowerment, and I'll be going into this more, simplicity, and affordability, which is specifically cost savings. And I'll show you several examples how companies can save money. And that is where they're going to want our product. So the empowerment features for practitioners. Well, it's easy to use. Our systems provide a graphical user interface. It's extremely easy to use. You know the information you want to go into, and it's audio and visual. And it's compatible with other electronic records software. So your accounting side, if maybe you're running an SAP or something like that, well, our software plugs right into it, and you can have B2B transactions. So here's an example of why it's why it's simple. So as you can see here, this is our graphical interface for one specific patient. You can see here that the provider name's there, the claim ID's right there. This information flows throughout the software through the front office, into the back office, into the practitioner. So you can see who the provider is very clearly and the date of service. In this case, just point out a couple features here. It has the important vitals of the patient itself, being a male, 165 pounds, and 36 years of age. And this helps the doctor key in information very quickly. You don't have to have them go through the back office and get them measured and weighed, every single time. Your height, the age is right there. It tracks it right with it. The contact information. So these really important vital information is right there for you. It also shows here there's some history of the blood pressure, and you can see on 12/1 it was 110/70, and now on 11/24/2012, which amazingly is right now. My blood pressure, this patient is 200/110. And you can see here there's a nice drug interaction that shows the doctor right away that this drug interaction is sulfa. Don't prescribe this sulfa. There's some notes down there as well. Well, this is important because this saves the doctor potentially from getting sued. This is the type of information that doctors are going to be demanding over the next 15 to 20 years, and excuse me, the next 5 to 10 years. So I'm just going to go to the next slide. Now we have stuff for the patient, and I'll show you some examples of that software. So patients want to have the answers to specific healthcare questions. Our software actually provides it for them. So when the patient signs up with the doctor, they automatically get software that enables them to get specific health questions answered. They don't have to come to the hospital to do it. So it's an extra benefit that the patients get. And I think the doctors are going to find that it's going to be very interesting for their patients, and they're going to like this service, and which is hopefully going to have repeat business for them. We have appointment scheduling automated. They can get their prescription refill requests put in. There's private password protected email. This is really important. This medical information is not stuff you just want floating around the internet. This is stuff that you want private, and you want it secure. So if your doctor's sending you a message over email, you want it password protected, you want it encrypted, and we provide that. So much different. We are thinking a little bit ahead of the time here. This is not just World Wide Web Wild West. We're actually thinking about how can we provide the most safety, and we do that with McAfee empowered security. And what's really the key here is for the patients, and they get this free, and this is why they're going to find a tremendous value, is they get the My Healthcare portal that Singularity provides. This is a new software that we've developed and we think is going to change the industry in terms of preventative healthcare. So this is the My Healthcare screen, and this is, as you can see here, there's quite a bit of information. Now I'm going to walk you through this. So this is what the patient is seeing. And the reason I have this particular screen is because I've answered some questions in my survey. It's an easy 10 questions. And in this survey, they have found that my eating habits are not that good right now. This has been a health indicator that has been brought up. So one of the ways that my eating habits are impacted, you can see down over here, the blood pressure, my cholesterol, my emotional health, and triglycerides could be potentially impacted by my eating. I do have good blood sugar and good weight, but this is just saying, hey, you're okay right now, but this is something else you can maintain as a preventative issue. So it goes in detail into what it's about, and then there's some links in here to talk about the recipe collections. You also have additional information, and then down here we have health coaching, and this is really neat part of our medical software. This provides coaching that a doctor doesn't necessarily have to provide for their patients. So this is all driven through Mayo Clinic and their health system. We've partnered with them to help develop this software, and this particular coaching can help them get through and get some of these very easy things you can do on your own. You can get the information and you can start doing it on your own. If I was to go through and show you, and if I had more time, I could show you about the motion, addressing stress, maintaining a healthy weight. All these things have different screens like this that we provide the customers, and they get this free. They get this free. So this is very powerful software, and this is a very big differentiator. A doctor can say, I can provide you something, and we can work together. Now they go and they get this, they take it, and they work together with their doctor. I'm going to move on. So affordability, what's neat about that? Well, we eliminate office transcription costs. We eliminate chart pulls. Prescription refill generation can be done right from your smartphone, all with our software. There's laboratory interface savings, salary avoidance, and I'll go into an example on prescription drugs in a minute. But it's just showing here, we project that the average provider, small to medium-sized provider, will save about $85,000 a year using our software. That's a big savings. That could be 2 people that you don't necessarily need that you have now. Big savings for the companies. All right, so I'm going to go into a specific cost savings example. What's so big about this? Throw a number up there. Give me an example. Well, I'm giving you an example. So the average staff time per minute on refills is about 15 minutes. Looks like it's a little cut off there, but it's 15 minutes, trust me. The average staff time per refill with the electronic medical record is 3 minutes. So we've cut 12 minutes off there. So if you have 400 prescriptions a week, your total side hours per year is 4,160. That's $70,000. 70,000.7 K. That's a pretty well-paid person. Okay, you are saving a pretty well-paid person in your practice, which could make the difference between breaking even and making a profit. All right. So what are we asking for at Singularity? Well, funds we're requesting $7 million. Now we're requesting $7 million, and I've broken down what we're requesting it for. We need capital startup money. Now this is to get our software going. This is to get the right engineers. This is to get the consultants who are going to help us advise us that are in the medical industry, in the medical electronic records. And then we have some operational costs for 1 year, $2.2 million. Research and development, $2.5 million. It's really important here, the research and development, this shows that we're not just selling this one-time thing. In the technology industry, we feel it's very, very important to reinvest money into making your products better, because your competitors are going to notice it, and if you aren't up on your game in this arena in technology, they will come and leap you. So we need the money to be able to go for the next thing. Once we start getting an inroads into our clients, that is what's going to enable us to provide the next generation software and the next generation software after that to stay ahead of our competition so that we can continue to provide the best possible software for the small to medium-sized companies. And once we have that market, then it's just a matter of us continuing to deliver over and over again. So our break-even analysis, we feel, based on 3 years, it's about 118 software package units to the practitioners. This will enable us to break even. Now, we actually break even in that 3rd year, but in the 5th year, we're up around $11 million in profit. So once we break even and we recapture those costs, we're going to actually turn a profit very, very quickly. And based on our projections, it could be better depending on how quickly we break into the market here. Timing is of the essence. So, what is in it for the investment community? Well, here's the deal. Our year 3 revenues are going to be $11.7 million. Our net income in year 4 is $4.8 million. In year 5, that's going to be $11 million. So we feel that we're going to make up that cost, that original $7 million, sometime in year 4 or 5. We are prepared to offer our investors 40% in stock and 10% in cash per year, and a single seat on the board of directors. And what this shows is that we're very serious about this market, and we want to get into it. And we understand that $7 million is a significant amount of money, but in order to win, we need it. And we want you to be on our team and share in those winnings when we win it. So what is our exit plan? Well, ideally, we'd love to grow the company. We feel we have a real tight strategy in doing that. We're going after the right market. Right now, it's underserved. Microsoft, GE, Allscripts, they don't really want to touch it right now because it doesn't really bring in the profits that they're looking for yet. But we feel that we could jump in there and make a huge winning now. Now, we want to further diversify and grow in the healthcare industry. We would love to take over the entire United States in this arena and then project out globally when that time is. What thing that could happen is we could be attractive enough in 5, 6, 7 years that a GE or a Allscripts may want to purchase us and buy us out for a large sum of money. It will be a highly valuable proposition for them. And it'd be pretty natural to what they're doing. Allscripts and GE and Microsoft, these companies generally do acquire when they're trying to grow. They don't try to grow organically. They try to inorganically acquire, merge, and those type of things. But I want to be clear that we want to grow this company. So, I appreciate you being here, and I really appreciate you listening to my business plan. But the time is now to invest. We have an opportunity to capture this market. and we feel that technology cannot wait.